Hello and welcome! We designed a low-cost tube thoracostomy model that is an affordable and effective training tool. Our model is designed to simulate the physiology of a pneumothorax. This model is meant to be a teaching tool for physicians in training who are learning how to place a chest tube. In this video, we will demonstrate the steps for assembling the model. The materials you'll need are a 6-quart plastic container, rack of pork ribs, a produce bag, straw, plastic wrap, an absorbent pad, and tape. You'll also need cutting tools such as shears, box cutter, and a drill. We recommend using a rectangular plastic container for the model base. The first step is to drill a hole on the short surface of your box. You're going to want the diameter of the hole to be a little bit larger than the straw. Choose a spot in the center of the plastic surface to create the hole. Apply gentle pressure with the drill. Be careful not to apply too much pressure or the plastic will crack. If needed, expand the hole. It should be large enough to easily accommodate the straw. Watch out for sharp edges. We're almost done preparing the thoracic cavity. The last step is to cut a rectangular area out of the lid. Be sure to leave a margin of at least 1.5 to 2 inches all the way around. You can use a box cutter for this step if you have one. We use the drill to create 4 holes in the 4 corners, and then we use shears to cut out the rectangular area of plastic in the middle. Again, watch out for sharp edges of plastic that could cause injury. Trim away excess plastic to make the cutout area bigger if you need to. Since the rack of porcine ribs is going to rest over the lid, you want the cutout area to accommodate as many rib spaces as possible. However, you want the margins to remain thick enough to support the edges of the rack. And that's it for the model base. The plastic container and lid can be used over and over again in future sims. For the next step, you'll need a produce bag. We recommend using a colored bag or a marked bag so that it is visible through the clear plastic container. The straw acts as the trachea and cartilaginous airway structures, while the produce bag is the lung. Start by placing the straw inside the bag and wrapping the bag tightly around it. You will need to pass the straw and bag through the hole so that the quote lung is inside the plastic box chest cavity. This step can be a little challenging and requires some patience. Be careful not to shred the plastic bag as you're passing it through the hole. You might need to readjust the bag and straw multiple times to get it all the way through. Small tears in the bag can be repaired with tape. Make sure that the straw doesn't slip all the way through the hole or you'll need to start this step over.
With our airway inside of our chest cavity. This is a pretty snug fit, and that way it's airtight, so when the chest tube is placed correctly, the lung should expand without.
In the next step, we're going to create our pleural membrane with the plastic wrap and tape, and shears. Measure and cut the amount of plastic you need to cover the top of container, and use tape to secure the corners first. For this step, you want to make sure that the plastic layer is really tight over the surface of the container. Adjust the plastic as you work and pull it taut to make sure that there's no laxity on the surface. You're then going to apply a layer of tape over the entire plastic surface to make your simulated pleura thicker. It's easiest to work along the length of the container while you're doing this step. As you're laying down the tape, be sure to press down the edges of the plastic to make sure that there's an airtight seal underneath. And now we're ready for the ribs! First, replace the lid over your plastic parietal pleural membrane. The margins of your lid are going to hold up the rack of porcine ribs. Adjust the rack to place as many rib spaces as possible over the cutout area. More rib spaces means more practice attempts. Then, cut away any of the excess meat with your shears. Place another layer of plastic over the ribs and then cover that with your absorbent pad, cutting away any excess length. Since the absorbent pad is free and available in the hospital, we use this to hide the rib spaces. However, you can use any vinyl or fabric that is opaque. Use tape to secure the edges of the pad against the plastic container. Again, while you're working, make sure you create an airtight seal under the pad. The purpose of this step is to cover the rack so that learners have to go through the step of palpating rib spaces before deciding where to place the chest tube. Whatever material you use, Tuck the edges of the pad close to the top of the container, leaving the walls open so that the bag inside is clearly visible. After this step, your model is complete and ready for use. Let's place our first chest tube. The learner should go through all the steps, including palpating the rib spaces, making the initial incision parallel to the ribs, dissecting through the tissue, transecting the pleura, and using their finger to feel the underside of the rib spaces to confirm correct entry. After securing the tube, it can be connected to suction. You can use a pleura during this step, but we just connected it directly to the wall suction for demonstration purposes. Turn on the suction. If the tube is placed correctly, you will see your simulated pneumothorax resolving right in front of your eyes. This model is designed to sustain multiple practice attempts, so let's do it again. To reset the model, carefully remove the sutures in the initial chest tube that was placed. Place a piece of sealing tape over the incision site. This will restore the airtight seal and mark the area so that the next user doesn't use the same spot again. Now, let's find our next rib space and reset the tube materials. We can go through the steps again and place and secure our next chest tube. After we're done, we'll connect it to suction, and if we did it correctly, then just like the first time, we will see our pneumothorax expanding and resolving. And there you go, that's all there is to it. We hope you enjoyed this video, and happy sim learning!